Hi, my name is Donna and this is Pickles. She is a 15-year-old lineolated parakeet. Join us for a demonstration on administering oral medication to small parrots, including techniques for drawing up medication and cleaning the syringe. I observed Pickles exhibiting heavier breathing and frequently adjusting her crop, which can be typical behavior for birds. However, given that she was doing it after every meal and had vomited a few times, I promptly contacted my avian veterinarian and scheduled an appointment. Because of her age, health history of respiratory issues, and previous diagnosis of cyanosis, my veterinarian promptly conducted her examinations to minimize stress. Birds tend to breathe heavier when stressed, especially at veterinarian clinics. Although my vet didn't detect any masses upon examination, it's still possible that there could be hidden masses deep within her body that could be exerting pressure on her organs or air sacs, which leads to breathing difficulties. Additionally, she has been diagnosed with a cataract in one eye and arthritis in her feet. My veterinarian suggested that the issue might be a secondary infection, possibly originating from underlying health concerns detectable through x-rays and blood tests. However, given her age, the procedure poses risks. Sedating her for an x-ray could be dangerous with no guarantee of her waking up. My veterinarian recommended administering 2 injections, one for inflammation and another for pain. These injections were injected on each side of her breast muscles. Antibiotics were prescribed for me to administer at home to aid in her recovery. The medication is to be administered orally twice a day for 14 days. Birds will require capture, holding, and restraint in order to give medication, unless the bird is trained to voluntarily take medication. It's best to train birds to voluntarily take medication from a syringe before the bird actually gets sick. Training birds to voluntarily take medication from a syringe involves putting unsweetened applesauce in a syringe and reward the bird when they touch and then swallow the applesauce. By doing so, it will be easier to give medication without having to capture, hold, and restrain. My veterinarian advises against adding medication to food or water unless absolutely necessary, as it's difficult to control doses and the bird may not like the taste and will stop eating or drinking. I will have to capture, hold, and restrain Pickles with a towel, as she will not take the medication voluntarily. It is important to learn how to safely capture, hold, and restrain your bird properly. Birds are held around the cheek or jawbone, not the chest area, as birds do not have a diaphragm like mammals. They breathe by expanding their body cavity, so it's important to avoid putting any pressure on their chest, as it will affect the bird's ability to breathe. They also have complete tracheal rings, which allows firm handling near the neck and jaw without concern for choking compared to other animals, and that's why it's safe to hold them around the head. Holding them this way allows the bird to expand its body cavity to breathe freely. When given medication to a small parrot, make sure to have everything ready. Have a small towel, such as a hand towel or tea towel, and draw up the medication first. Now I will show you how I give oral medication to a small parrot, including techniques for drawing up medication and cleaning the syringe. So make sure you know how to store your medication. Some do require refrigeration. Your vet will tell you, and it'll also say on the medication jar. So always make sure you know if it needs to be in the refrigeration or not. This one says to shake well. So I'm going to give it a shake. I shake it back and forth, and then what I do is put it upside down because a lot of the medication will settle at the bottom. Just kind of shake it back and forth. There, and I give it a second just for the medication to, come off of the lid up above, because if you open it up, the medication might just, be all in the lid or it'll fall down on the jar. So I just give it a few seconds, tap it, and that should be good. And then I open it up, and now I have to fill up to that red line, which is very minute, is very small amount of medicine. So it's all shooken up, and I keep it closed, and I put it right in. And what I do is I draw up more than I need, because the first time you draw it up, you will get air bubbles in it possibly, which I don't even see any, I don't think. But anyway, just to be sure, so I pull up more than I need, and I will do that a few times inside the medicine. All right, and what I do is I scrape it. I scrape the syringes on the side of the container, so you're not wasting the medicine, and the medicine isn't all over the syringe. You don't want to run out of medicine. So it looks pretty good. There's no air bubbles in there. So what I do now is I'm just using my, right here, to push it down. That's my bird singing in the background. And I'm going to scrape it again, because you can see on the sides all the medication that I scraped off. You want that to go back in the jar. And I just place that down. I put the lid on it so I don't spill it, because if I put it down it might spill. I'm going to put it on a hard surface. Now it's closed, so it's safe. So now I have my medicine, which is at the red line, and that is 2 units. And now I'm going to give it to my bird Pickles. It's time for Pickles' morning medication, and I'm going to show you how I hold her and capture her. Now she's in a travel cage, and you know, to catch them from the actual cage, which is larger, is a little bit harder to do, as they try to escape you. But you got to be really quick and just grab them so that they're not running back and forth. So hopefully she'll just let me catch her. Yay! Alrighty then. Okay. So I'm just going to get her situated in my hand. So as you can see, my thumb is under her cheekbone, and my index finger is around the other side. I'm not holding her too tightly. As you can see, she struggles, so I'm gonna, when they struggle, you can hold them a little bit tightly. You just go underneath the jawbone, and this is just to hold the head straight so they can't, you know, fight with you, bite you, and you need to get the medication in. You don't want to be poking their eyes or anything like that. So you got to hold their head pretty straight. You can even lift up their neck, and birds are very hard to strangle. They have like a complete tracheal ring, and they're pretty tough. It's not like other animals where they can choke very easily. You don't want to be squeezing the neck together. You're holding under the cheekbones to control the head, and her back is laying in the palm of my hand, while these fingers are holding her left side of her body, and my thumb pad is holding her right side of the wing together. So putting them in the towel, just it's a little bit easier. They don't struggle as much. So I'm just going to transfer her into a towel. Come here, baby. Okay, and I am not constricting the chest. So when you hold them like this, the chest is free. Okay, you don't want to put pressure on the chest, as they need to. You can see, especially if she has a breathing issue, you don't want to constrict the chest. Well, you don't want to never do that, but always leave the chest without pressure. And so with the towel, you can kind of just lightly wrap them around so that they're, you know, safe and secure. There's still no pressure on the chest. It's just wrapping them around so their wings don't get out. And so when you give the medication, it's best to do it from the side. You don't want to go from the front. Sometimes if you go from the front, they won't open their beak. You just put a little drop here and they'll swallow it. But never just go from the front and stick it right in the middle. They can choke. It might come out of their nose, or it can go into their lungs. So always go from the side. Either side is good. I'm going to do this quick because, you know, she does have a breathing problem. And it's a very small amount of medicine. So what I do is go on the side, give her a little bit, let her swallow. You can see her swallowing, and give her the rest. There, and now what I do is just wait a few seconds, because you don't want them to shake their head to, you know, release all the medicine. I think she did pretty good. So I'm going to release her as quick as I can. There we go. If you're giving your bird medicine and your bird is in like severe stress, panting, doesn't, you know, look too good, you want to just put your bird away. You can do one drop and then take it back out later, do another drop. If it's a large amount of liquid, you will have to, you know, take longer. Just do one drop at a time. Never just squirt the whole thing in there, or you can choke your bird. And you can just keep an eye on them for a while. I'll just let her relax in here and then put her back in her other cage. If any medication, spills on the bird around the feathers of the mouth, you can just use a warm, wet cloth or just paper towel and dab it up, because you don't want it to dry in the feathers. It'll become hard and cakey, and the bird will, be uncomfortable. The bird will scratch at it and, cause a big problem. So always just make sure the bird is pretty clean. And also, when you're given medication, make sure that the medication goes over the tongue and not under the tongue. It's the next day. She's due for her medication, and now I'm going to show you how I do it directly with the towel. So I just get the towel ready. This is a tea towel I folded in half, and I just put the towel over my hand. I put this into my dominant hand, and I'm going to pick her up gently and wrap her up like this. And yeah, sometimes it's a little bit simpler with the towel. All right, girl. Let's put the towel underneath her chin. Her chest, again, is free to breathe. It's not being compressed. This is just to hold the towels gently against her body. So if you notice her beak, let me bring her closer. Girls, okay, stay still. Her beak is open like normally. She does have an overgrowth of the bottom beak here, and that's why her mouth is open. So sometimes it's a little bit difficult when your bird won't open the beak. So I'm just going to give her medicine, so it's easy for me to give her the medicine. And I'm going to show you on a bird that has a more closed beak how to get the medicine in. So she had one little drop, 2 little drops. There we go. Yay, good girl. You're getting better every day, aren't you? Okay, let's put that back to the cook one, and she's good. So I'm going to show you on a bird that the beak is more closed. Now I'm not going to give it medicine. It doesn't need medicine. I'm just going to put water or unsweetened applesauce in it. This is Tinkerbell. She's a bird parakeet, and she's going to demonstrate taking some applesauce from the syringe. Now her beak is more normal. It's closed, and some birds, it's very hard to open up their beak, and they won't do it. But normally when you just come to the side here and just put a tiny little bit there, they will start to lick it. And she's not licking it, so if they don't, what I do is just kind of open the beak, open the tip, and then slide. Let me just hold her head a little bit more and slide it over to the side. Like that. And again, you can lift the beak and slide it over. Always go from the side. Good girl. Good job. The syringe should be washed after each time you give medication. You shouldn't leave the medication inside the syringe. It'll just get hard. It'll dry up, get hard. It'll block the opening to the syringe as well. And you want to give fresh medicine each time. So what I do is I turn on my hot water, and I just take the plunger out, and I run water through the syringe, make sure it comes out the other end, and I just check to see if there's any medicine left in there, which I don't see any. I just do it a few times just to make sure that I got it all, and then I'll do the same with the plunger, especially the rubber tip. Medicine will stick to the rubber tip more than the plastic part. Just washing all of it. And then just shake this part to get the water off from the inside. This one too. Then I'll place them on a clean towel. This is just paper towel for them to air dry until the next use. Thank you for joining me on how to give oral medication to small parrots. If you like this video, then you may like the video on the screen. Until next time, happy birding!